See. All right.
Is it?
We're live.
No way.
What's up, guys? So the internet didn't work inside.
Embarrassing. Embarrassing.
So we're outside. We're gonna take two. So hopefully the internet will stay on out here. It should be good. We were kind of in the basement. What's up, Aussie? Hi. All right, so we're gonna start all over again. So if you were watching us before, we're gonna repeat ourselves. So yesterday, if you saw my live, I was talking about how so many of us learn all these different acupuncture techniques, and we take courses from different acupuncture masters. We learn different point combinations. We get a lot of different techniques and modalities in our head, which actually screws with our confidence in the treatment room. We don't trust our own ability to treat the patients with the knowledge that we already have. You know, with in the United States, it's like 4 years of schooling. You study your buns off.
Yeah.
We know so much. And then when we get in a treatment room with a patient, we're like, we freeze. And we overthink and we overanalyze instead of being really present with the patient. Thumbs up. Hi, Stella. So we want to talk about, so I want to talk to Alad because I feel like he's a really good example of using your intuition. Even though you have learned, Elad, a lot of other styles, and you've studied like Kiko, you said.
Yeah.
You've studied abdominal acupuncture. You know, even though, hi Gil, even though you have studied all this, you're still very much in flow in the treatment room, you know, and
Yeah.
you still read people's bodies a lot. You don't let all of that knowledge that you've learned block your confidence and your ability of your trust in what you already know to treat the patient.
It should be the other way around. If you study more, you know, you should know better what to do. It
I
shouldn't
know.
make you confused, you know?
I totally agree. And, you know, but I get a lot of emails from acupuncturists who feel so lacking in confidence in their ability to diagnose and treat a patient, even after they've been in practice sometimes for like 5, 10, like 15 years. It's almost like sometimes people go backwards, and then the longer they're in practice, the less confident they get. And I think it's just because they start to study all these different people's styles, and then they start to question their own style. You know, and what I stress and what I talked about yesterday on my live is how important I think it is to use your intuition with your patient.
Yeah.
You know, and not question what comes up for you to treat in that patient. You know, whether it be like a classic needle or a classic point combination protocol or not, you know, like whatever comes up in you when you're present with that patient, I think is the most important way to treat. But so
Yeah.
many of us, including me in the past, you know, question our intuitive ability to treat our patients. You know, I was sharing before that in the beginning, I literally used to Google points, acupuncture points, with my patients. I would, you know, treat them once and then like Google their symptoms and which acupuncture points to use. And next time they were in, I would use my Google points to treat the patient. Like,
Great
how
idea.
disconnected.
It's a great idea.
You know, I
Why
was
not?
so disconnected from my
It's
patient.
gonna help some people. It's gonna help.
Yeah, exactly. And you know, that's what I said, is to a point, it actually does help. To a point. No pun intended. But when I started to really tap into my intuition with the patients and being present with the patients and really like flowing with whatever came up in me, whatever I wanted to ask them, that's really when I saw some amazing, amazing healing go on in my practice.
Yeah.
So I want to talk to you,
Me.
about, you know, how you flow in your treatment room.
I think that the first thing that comes in my mind when I see a new patient, so it's an old patient, it doesn't matter. Like I see a problem, I try to analyze it and simplify it.
Yeah.
Like if it's a big problem, many symptoms, I try to, like when you're doing a math problem,
Yep.
you just need to, this and this is the same, it's the same meridian, so it's one, and this is the same symptom, but different complaint, like
Yeah.
this is dizziness and this is vomiting, so it's the same for me, and this is the same, so I try to get to one root.
Yeah.
And I think that if I can explain to people that most of the times they have only one problem, and one organ is going out of balance,
Uh-huh.
this means I really understand it. And if I really understand it, usually it's gonna work. Usually, it's sometimes
Yeah.
it don't really help, but
You never know.
yeah. But if you can understand all of the symptoms are caused from one organ being out of place, and then the other organ maybe going out of place, and then
Uh-huh.
so it simplifies things for you, and then you know what to do because it's one organ.
Yeah.
It's one problem. You need to tonify it.
Yeah.
You need to, I don't know,
Okay.
whatever.
No, I think this is a really good point that Elad is making, because, I mean, how many times, do patients come into our practice and they have everything wrong with them, right?
Yeah, they have a lot of disease. They have a lot of
Yeah.
big Western names
Yeah.
for everything.
Yeah.
So it's
A lot. And so what Elad is saying is like to really focus in on what is the one organ, what is the root to like all their 10, 20 different things wrong, because it does start, in one spot, and then it's the domino effect of all the other things going
Yeah.
wrong,
Yeah.
and we sometimes forget that because we get so overwhelmed with all the different things going
Yeah.
on with the patient, that we're trying to diagnose and treat everything.
Yeah, we say, okay, he has liver chi stagnation, let's say TCM style. Okay, he has liver chi stagnation, spleen chi deficiency, heart chi deficiency, and liver yang rising.
Yeah.
So what am I going to do? Am I going to start with the liver yang rising? I'm going to start with the liver chi deficiency.
Yeah.
I'm going to treat the heart. I'm going to do what? What am I going to do?
Exactly.
But probably it all started with one organ.
Yep.
You just need to understand and find a way. This is the second thing we need to talk about.
Yeah.
We need to find a way to make sure that what you think is really what's going on.
Yeah. Okay, so first, so first you have to remember with your patients that is one organ. You're searching for one
The one organ. Yeah. Maybe two.
Maybe
But
two.
Most of the time, for each appointment,
Yeah.
try to focus on one.
I agree.
It's not-
Because again, like you can just get overwhelmed because you can want to treat everything in a patient.
Yeah.
I personally have felt livery, spleeny, kidney-y all at once. So I know that there are patients walking through my practice door that feel that way too,
Yeah.
and it can get very confusing. And so the first point is to really work on focusing in on just one organ, and start to treat that one organ. So Elad, what is, from your experience, in your opinion and your thoughts, what's the best way to figure out what organ that is?
You need to find a way to understand, make sure that you understand. You know what what's the problem?
Yeah, like I know what you mean. Make sure that you understand.
Yeah.
Like well, keep talking. We'll find.
Yeah,
the
okay,
word
find
will
the
come
word.
to
We'll
us.
find the word. But anyway, you need to understand that what you're doing is really it's not like a story that you invent, like a made up story.
Yeah.
You need to understand that, okay, I'm doing this is a stomach problem. Okay, I needle the stomach now. Is it better?
Yeah.
How can I know it?
Yeah,
Like if
exactly.
the person is complaining on vomiting, if he's not vomiting, is it working? No, because he wasn't vomiting when he came. Okay, but you need to understand what's the problem. So I do a lot of palpation.
Yeah.
I do a lot of abdominal diagnosis. This is Kiko style because this is what I do. So I do a lot of that. I do some pulse diagnosis,
Yeah.
but a little bit and very shallow because I didn't master it.
Yeah.
There's people who's amazing in pulse diagnosis.
Oh my
but,
God, so good. Yeah.
But I'm not doing it. So
No.
I use it if I think, okay, is it excess or is it deficient?
Yep.
So I use the pulse for that, but I don't use it all the time.
Yep. Okay. Yeah, and so what is the word we were trying to think of? No.
Verify.
Is that it?
Yes.
Boom.
Yes.
Okay,
Yes,
so-
yes, yes.
so yes.
after
Yeah.
I understand, I think the stomach is the problem.
Yeah.
I think the stomach is causing the problem and the liver is making the problem because the stomach is doing it, and the spleen chi deficiency is because that the stomach is excess. So I want to use the stomach. I want to treat the stomach. So then I think about what acupuncture point to needle. It's very easy because you're doing only the stomach. You're thinking about the stomach, and then you can like make it a little bigger and say, okay, maybe I can use a spleen point, or maybe I can use this point, but still you're thinking like the stomach is the problem. And after I did it, I want to verify it. How do I do it?
Yep.
Some people take pulse and say, okay, the pulse for the stomach is different.
Yep.
Now it's not wiry anymore.
Yep. Yep.
I palpate the abdomen, and then I say, okay, now it was painful before, now it's not.
Yep.
It's very easy for me.
Yep.
But then I know it's working.
Yep.
If I don't know it's working, the patient doesn't know it's working.
Yep.
So everything becomes like a voodoo story, like
Yep.
Chinese medicine magic.
Yep.
Like, it's gonna be okay, don't worry, I'm telling you, but you need to make sure it's working because
Yep.
it's not bullshit, it's real medicine.
Yeah, and I think this is a really valid point because quite honestly, in my clinic, I never really verified that it was working other than I'm very good at verbally giving them the
Convincing
confidence,
them.
yeah,
Yeah.
that like this is
gonna
gonna
be
work.
okay, it's
yeah.
gonna be okay.
But I really like that, you tell people or how you work is by actually physically verifying it in one way or another, whether it be through
Yeah.
palpation,
Find a way.
through pulse, yeah. And so, yeah, you were telling me earlier that you think it's good to master one of those ways
Yeah.
where you can verify that your treatment is working.
Yeah.
And whether that be through pulse, whether that be through abdominal palpation, channel palpation.
I think this is the reason that young practitioners, like new practitioners, always do pain management. Because if someone is complaining on a shoulder, and when he's doing that, it's not painful. That's it.
Yeah.
This is
Yeah.
now it's verified.
Yeah.
It's worked.
Yeah.
So it's better to start with pain management because it's easier.
Yeah.
It's easier
Yeah.
to verify. But after a while, you find new things. You check the pulse every time that you make someone's shoulder feel better. Check the pulse before and after, and then after I don't know how many times, you know that okay, it's going to be better, even if it's internal. And you tell them, okay, your pulse is different now; it's going to be better.
Yep.
So you verified it.
Yep.
If you don't want to do abdominal, I don't know why, because
Yep.
everybody should do abdominal. Everybody should do it.
Yeah, I never really learned abdominal, but I think it's amazing.
You have to learn.
Yeah, I'll look into it. So, okay. So first is you want to remember that no matter how many symptoms that they come into you with, really focus in and hone in on what one organ is at the root of all of this. And this is what's so amazing about Chinese medicine is that it's the basics. The basics really, really, really work. And so we get so far away from that sometimes, and we confuse ourselves, and really it's bringing yourself back to those basics to really give you the confidence in the treatment room. So hone in on what one organ is the root to all of this, and then as you're treating your patient, master some type of system that you like, that you're good at, that works for you, to verify that your treatments are working in the treatment room as you're with your patient. And like we're saying, that can either be through pulse or it can be through some type of palpation, because points can feel tender 1 minute and not the next. And so that is a really awesome way to verify instantly
Yeah.
in the treatment room that your treatment is working.
Yeah.
You know, and so just those 2 points alone, you know, really would help somebody's confidence in the treatment room with their patients.
Yeah. Hope so.
Yeah. And then the other point we were talking about was the basics of Chinese medicine.
The basic questions, yeah. This is
Yeah.
if you can explain things. We studied it like first year, I think.
Yeah.
So everybody, is it outside, inside?
Yeah.
Is it heat, cold? Is it excess, deficient, or is it yin and yang?
Yep.
So you can ask these questions, but somehow in a different way.
Yep.
But I think, is it excess, deficient? It's the first question.
Yeah.
This is, for me, it's always the first question. Is the patient, is it excess or deficient? Because you can just make a cross on half of the problems, half of the syndromes, if it's excess, and half of the problems if it's deficient.
Yeah.
And then it's quite easy afterwards.
Yeah.
Because if you decide it's easy, so it doesn't really matter. And then once you diagnose, you can do whatever you want. You can needle whichever technique you want. It doesn't
Listen to
really...
him.
No, it doesn't really... Okay, like a few days ago, I teach at Riedman College.
Uh-huh.
And a few days ago, we did in a course with techniques, needling techniques.
Okay.
And one guy had an ankle, sprained his ankle like 10 months ago. Still painful.
Yep.
So it's the point that is actually in pain is gallbladder 40.
Okay.
So it's not a deficient guy, okay? It's an excess type of body type.
Okay.
So you look at him and you say, how come this guy still has sprained ankle after 10 months?
Yeah.
It's not normal,
No,
you know?
that's not normal.
Because if it's painful, it should be more painful,
Yeah.
or it should be less painful.
Yeah.
It shouldn't be the same all the time.
Yeah.
So when you think about it, like excess kind of guy, what excess kind of the body, what kind of stuff is it excess? Usually it's the yang ming, it's the intestines.
Yep.
So I checked the stomach, the mu point of the stomach,
Okay. Yeah.
CV12,
Yeah.
and it was painful.
Okay.
And then I said, okay, if it's painful and it's gallbladder 40, let's check, maybe the problem is not gallbladder, maybe it's the stomach, because it can be the same muscle.
Yep.
So I palpated the stomach meridian and I palpated the gallbladder meridian,
Yeah.
and the gallbladder was okay and the stomach was very painful.
Okay.
So because it's a TCM school, so I didn't do Kiko style because
Yeah.
it's confusing. So I did stomach 36 and I did large intestine 11 and CV12. It's
Yeah.
really,
Nothing crazy, you guys.
no, it's really easy.
The basics work. They're PowerPoints.
But the thing is that the ankle is almost disappeared, and
Amazing.
then
Instantly, like in that treatment.
yeah, of course.
Yep.
And then we said, okay, let's look for another point on the stomach meridian that can help, and we did the fire point
Yeah.
on the stomach meridian, and the pain was gone. So it's
Yep.
it's not magic. It's just
No.
the problem is actually this guy problem is in his digestive system,
Yep.
and the ankle is just a symptom.
Yep.
It doesn't go away because of the digestive system.
Yeah.
The body don't have, like, you can do, I don't know how many things, but
Yep.
the body can do only.
Yep.
1,000.
But I mean, listen to how like simple that was that you diagnosed that, you know, and so you don't have to complicate things. And like, if you watch my stuff, you know I talk about this a lot. You know, like don't complicate things. Like our medicine is so awesome because it's so simple. You know, so
If you complicated it, you're probably wrong.
yeah, yeah,
You're probably wrong. If I complicated stuff, it means I'm way off,
yeah,
and it's not gonna work, and the patient's gonna go out, and I just pray to God that it's gonna come again, that I can make it better.
Yeah.
Because what I did today wasn't treatment.
yeah, yeah. Yeah, and
Happened.
then I want to also stress again the point that you made where once you get the diagnosis down through these simple ways of honing in on the one organ and having your way to verify if your treatment is working within the treatment room, and then breaking it down to those, you know, excess, deficient, hot, cold, yin, yang, interior, exterior. Once you break all that down with the patient in front of you, then it really doesn't matter how you treat them or with what style or what technique.
Because everything works, you know.
Everything
TCM works as long as you know what you're doing. Because TCM work, Kiko style work, I don't know, stems and branches work, 5-element works, everything works.
Yep.
So apparently, it doesn't really matter.
Yeah.
As long as you know what you're doing when
yeah.
you're using and when you use what you use.
Yeah.
This is the key idea. As long as you diagnose and you can explain it to the patient, that's it.
Yeah, exactly. And I think that that's a good point too, is that keep it simple to the point of where you can explain your diagnosis to the patient.
Yeah.
You know, and when you can explain it to the patient and it's not this complicated thing, then you're probably right on track. You know, and then just use whatever technique that you love using, or, you know, like I stress over and over, just intuitively treat the patient with whatever points come up out of you that you want to use on this patient now that you have simplified and narrowed in on their diagnosis.
Yeah.
Keep
Easy.
it simple. Yeah, easy.
No, it's
No, it's easy.
No, it's easy.
It's like, it's simple, you know, but
simple. But you need to get over, like, don't think too much.
yes, and that is the problem with so many acupuncturists, you know, is
You
that
want to help. You want to do that. You want to do that. And then he said you have a big thingy, Aziz, with something Western. I don't know. What is it? I have to Google it. No, it's a big problem. Oh my God, what am I going to do? No, it's a stomach problem.
Yeah.
No, it's a liver problem. If you think like that, if it's a liver problem, you don't have that many options.
Yeah.
It's an
Yeah.
excess liver problem. Do something.
Yeah. Yeah.
And you have to learn more. Of course, it's not that easy.
Yeah.
You need to learn more, but for the beginning, it's enough.
Yeah, and I mean, but
You
you
can
could treat
help a lot
this
of
simple
people.
way forever.
Yeah.
You know,
you
like,
can help a lot of people.
yes, you can help everybody that comes
Yeah.
into your treatment room, really.
Yeah.
You know, so, you know, I just want to stress, keep it simple, you guys.
Simple.
And, you know, it's amazing to learn all these. Keep it simple. It's amazing to learn all of these different techniques and these different masters and their styles, but don't let that get in the way of your confidence and your trust in your ability to diagnose your patient, to treat your patient, not to mention, you know, your trust in the simplicity of Chinese medicine, you know, because the basics work. You know, they really work, and they really work well. Yeah?
Yeah.
Was there anything else that we talked about?
Fertility.
Yes! Okay.
Fertility.
Yes, thank you. Okay, so when I asked what you were having trouble with diagnosis, a lot of you guys talked about fertility. So what are your thoughts on diagnosing fertility?
Okay, so I'm actually not a fertility master, like clinician.
Yeah.
I only do fertility cases on patients who's already a patient of mine, because then I think I understand how the body works.
Yep.
So I know if it's an excess type, I know which kind of organs usually go out of order, and then I can help them. But if a new patient is coming and she needs, usually it's a she, someone who understand and read all the charts of the IVF, I send them to someone who's dealing with it, because I don't want to deal with it because I don't feel like I understand it. You know what I mean?
Yeah.
So you do that. But if it's my own patient,
Yeah.
I know him for, I don't know, like a year, or I know him like a month, I'm saying, okay, he's probably gonna have like all the time, he's gonna have a spleen problem.
Yeah.
So I'm gonna help the spleen
Yep.
get through it
Yep.
during the pregnancy. So
Yep.
you can help,
Yep.
but if they want to read all the charts, so I don't do it.
Yeah. Yeah. So I think that's awesome, because
I
there are a lot of
I
different.
have phone numbers. I just tell them.
Yeah, refer
try
out.
this one. Yeah,
You know, so
they're
okay.
amazing. Just talk to them.
There's so many things that Allah just said that's important. Did you know
Yeah,
that?
no, I'm going away.
Okay, the first is that, you know, so he's saying that he'll treat a patient for fertility if they're already his patient, because he's familiar with the way their body already works and what kind of support their body needs. So that's awesome. And then if
Because
somebody,
it's usually don't change.
yeah, things,
That's what I mean.
yeah, because people usually have a certain deficiency.
If they have a
and that's it.
spleen deficiency and you put some more stuff on them, the spleen gonna get more deficient.
Totally.
So it's the same.
Yeah. And so that's going to be their issue with fertility.
Yeah.
Exactly.
Yeah.
And so if somebody calls Elad, though, that is not his patient, he'll actually refer out, and he'll refer out to somebody that is a fertility specialist. And,
Great specialist in
yeah. And so that's so important because look at that abundant mindset, because so many abundant mindset. So many of practitioners, me in the past, all of us, we're so afraid to refer out because we're stuck in a scarcity mindset. And when we have a patient coming in for treatment with us, we want to hang on to that patient because, we want a new patient. And we don't leave space for the patients that are right for us. And so if Elad here knows that someone else can treat this patient better, he'll refer out. Without thinking twice about it. It's better for everybody, yeah. And so I finally got to that place in my practice where I was also referring out. But in the beginning, I was too afraid to refer out because I wanted to hang on to every patient that came to me. So it's so important that you said that because you really do only want to treat what you enjoy treating, in your clinic.
Yeah.
Why treat something you don't enjoy?
It's not even enjoy. It's because sometimes you do really sad cases, like bad cases.
That's true.
You don't enjoy it.
That's true.
But still, it's something that you can handle.
Yeah. Yeah.
You know what I mean?
Yeah.
It's something that you can understand, explain, and do it. Just do it.
Just do it. Kim. What's up, Kim? So that is our suggestions. Oh, we wish you were here too. That is our suggestions and Elad's suggestions on what to do with fertility cases. So, if they're already your patient, go back to the basics and all that stuff that we first talked about. Which one organ is it? How do you verify within treatment that the treatment is working?
Yeah.
And then break it down to the hot, cold, excess deficient, the basics.
And go study. Go and understand the Western way of thinking so we can help the patient ask the questions.
Yeah.
Because Western doctors don't always tell the patient everything he needs to know.
That's a really great point.
You need to master it.
Yeah.
You need to be like Asaf Mo,
Yeah.
Asaf Mo. So Asaf is always saying to his student, you need to be better than doctors, because doctors don't say everything to the patient.
Yeah.
You need to know better.
Yeah.
So be better.
Yeah.
Easy.
Yeah. Keep it simple. So, Kim, you're so nice. So, does anybody on here have any questions about diagnosis? I don't think anybody asked anything while we were talking. No,
Nobody's
nobody.
watching.
People are watching. Any question about diagnosis? Any cases that you have going on? Also,
Do you ever sleep? You never go to sleep, right?
I'm
It's
always
late.
on
It's
the
like 10
internet.
o'clock. It's 10 at night in Israel.
It's 10 at night.
She's talking.
We're doing a Facebook Live. So, let us know in the comments when you watch this video. Does this help you? Does it, do you want to hear more of anything? Is there any other specific questions about diagnosis or anything that Elad taught or we talked about that you have questions on? Let us know. And then I would just say, for those of you that don't know, Elad is one of the producers of the ICCM conference here in Tel Aviv.
Come to Israel.
It was amazing. It was
Next April 2019. April 2nd to 3rd.
Yeah. I want to bring a big crew of you people because it was awesome, and it was honestly a very different conference experience than I have had in the United States for so many reasons. For the lecturers and just the culture here. It was awesome. I mean, really, truly. And you guys. These guys are awesome. Did I say awesome? So anyway, the ICCM is really great. And he's one of the producers. And come with me next year. And Kimberly, going back to a patient. Okay. How do you stay looking so young?
Oh, come on. I'm 63 actually. I only look 37.
Only. So, come with us to the ICCM next year, April of 2019, and I think that's it. Let us know if you have any diagnostic questions, and that's it. We're gonna go now. We're gonna go.
Thank you.
Thank you.
Do it.
Oh, Kim Israeli comments was amazing. Yes, that's what I'm talking about, right? It was really special. Really special. We're on the camera. Do you want to do anything else?
No. What do we?
Oh, see, Diane, ICCM was amazing too. Yeah.
Yeah.
Oh, we have a question. Hi, Robin. I had dinner with Robin last night. She's an amazing acupuncturist. So, Robin, you come to the ICCM with us next year, definitely. So she's asking, what do you do when you hit a plateau with your treatment? This is your 60-day.
Like
This is
it's
your
not
thing.
working? This is what you mean?
Yeah, like what happens when you're treating someone and they're getting better and then it stops and they stay at the same.
Okay.
And you can't get that last 60
Usually,
to 80%.
Yeah, 60 to 80%.
This is Elad's thing.
No.
Yes.
So,
So what do you suggest?
it usually means it doesn't really always work, yeah? Let's be honest, you know. Sometimes
Of course.
you can help to a limit.
Yeah.
Sometimes. But usually when this happened, after one treatment, I try again. Like I do one treatment, it doesn't work, I try to do it again. Because sometimes I don't know what. And then I actually look at things again and trying to understand maybe it's not that organ anymore. Maybe the one organ I treated, maybe now it's deeper. Maybe, I don't know, you can look at it as the circle, like I treated the kidney, now I'm going to treat the lung, or I treated the liver, now I need to treat the kidney, something like that, or just change your diagnosis. Maybe you're wrong.
Yeah.
Maybe you were wrong all the time, and acupuncture works because it works.
Yeah.
But you need to try to look at the case again.
Yeah. Yeah, I think that's an awesome point because yeah, remember we were talking about it where it's like peeling back the layers.
Yeah.
You know,
like
and
an
sometimes
onion.
and sometimes it really looks like it's this one organ, but then when you get to a certain point with that organ, it's plateauing. You know, and it's not working anymore.
Yeah.
And so then it maybe wasn't that one organ, that wasn't the root, and so reassess and reevaluate.
Yeah. It usually, you see it a lot. It's not usually, but you see it a lot with access problems. And you clear the access and then you don't know what to do because the deficiency, it's different. You need to diagnose again for the deficiency because not always it's I don't know, liver young rising with liver blood deficiency. It doesn't work like this.
Yep.
Sometimes the liver is not the problem, but it make himself like, I don't know, I'm the problem, look at me, but it's not the problem.
Yeah.
So sometimes it's something else.
Yeah.
So you need to diagnose again.
Yeah.
I actually diagnose every treatment
Yeah,
because
that's really
this is
good
what
idea.
we do. Every treatment you diagnose again.
Yeah.
You palpate or you check the pulse. So actually what you're doing, you diagnosing every time again and again.
Yeah. 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 So yeah, I think that was an awesome answer.
Awesome. Awesome.
Yeah. You're welcome, Robin. Yeah, that is you could be wrong, then you should diagnose, and it could be a different organ that you need to focus in on.
Yeah.
And that is what's so fun about being an acupuncturist,
Yeah.
you know, because we're like little detectives.
Interesting. It's interesting.
Yeah, it's really interesting. Yeah. All right, cool. Any other questions since you guys are chilling?
Go to sleep.
Do I look tired? No.
You're not, but look at me.
You've had a long day. All right, you're welcome for your answer, Robin.
Thank
All right, so we're gonna go.
Yeah.
That was awesome. Let us know what you think in the comments. Come to the ICCM next
See you
year.
at ICCM.
Yes. We'll see you soon. Bye, guys.
Bye.